Welcome to the HST tutorial on a typical pain management chart. As you're aware, HST eChart is browser-based. That means anywhere that you can log into the Chrome browser, you can log into eChart. The eChart schedule screen has a couple of unique features. The appointment color itself will change as the patient moves through the continuum of care. The paperclip indicates that there are documents attached. The yellow dog ear indicates that there are notes attached to this case. If you want to see the notes or the documents attached, you press and hold on the appointment. This is also where your front desk will check the patient in, and you can see there's a history of physical attached and that the patient has a service animal. So the first thing we're going to do is hop into a chart. First screen that it takes you to is called the Chart Home. Chart Home has several tabs, including the current visit summary, which will update automatically as the patient moves through the continuum of care. The previous visit summary, and this is where you can access the PDF of any previous visit chart. This date is a hyperlink. When tapped, it will open the PDF of the chart in a new window. PDFs for HST are indexed so that as an anesthesia provider, you can go immediately to the anesthesia workflow. As a physician, you can go immediately to the physician workflow. It opens in a new tab so that you can simply toggle back and forth between the two. The header in HST eChart will have an image of the patient, all of the patient's information. It will have some banner alerts, in this case, a consent alert that indicates that there is an unsigned consent that needs to be done for this banner to go away. In the far right, you'll notice a print icon. You can print any page, any workflow, or any part of a workflow. The information button, which will always tell you the allergies and any important information about the patient, regardless of where you are. The pin icon, which we'll discuss in a few minutes, and the completion indicator. The completion indicator in eChart will tell you how complete each workflow is, and it will tell you when you're in each workflow how complete that workflow is, and it will total to 100% when your chart is complete. The system knows what fields are required, and it tracks them. Each chart is divided into workflows. These workflows allow a user to stay within their workflow to complete all the required documentation that they may need to do. And it's important that they don't have to navigate all over the place to try to find exactly what they need to complete their workflow. You'll notice for this chart in particular, the pain chart, there is no anesthesia workflow, but there are two intra-op workflows. One is for your circulator and one is for your nurse monitor. And we'll see those as we go through the chart. It's important to know that HST eChart allows multiple users in the chart at the same time. So that means as a second user, or in this case, the pre-op nurse, you will see that I am able to chart and have the chart open at the same time as the other provider. We're going to see how helpful that is in just a few minutes. So as the pre-op nurse, I'm going to hop in. As the pre-op nurse, I'm going to show you a few of the workflows. The first workflow here is pre-op communication. This is the workflow where your PAT team will call the patient and communicate the instructions and ask some questions. It's very simple to add in a call. Spoke with the patient, and in primary language is auto-selected for you. However, you can edit those however you choose. And you can leave notes if you want. Each block has a completion indicator in its lower right corner. In this case, this information flowed from the schedule. So we're going to say that the patient doesn't have a preferred name, but their gender identity is male. And you'll see the gender identity has now filled in the header. One of the tenets of HST eChart is to never have to enter information twice. The information you enter will flow from one workflow into the next. This is where you would put in your patient's email so that they can receive text messages and email messages. The patient's phone number, if entered here, will also enter in practice management. So any changes in this block fill in the same fields as those fields in practice management. And you're able to enter that information, if it hasn't already been supplied for you, directly into the chart, and all users will be able to see the information that you entered, including the practice management people. The next block we're going to look at is allergy. You can see the completion indicator for allergy is red. If you tap on a red indicator, it will always tell you what is required to complete the block. In this case, you either have to report that the patient has no allergies, or you have to enter an allergy. So I'm going to go ahead and enter an allergy for penicillin. We're going to say it's a true allergy, and the patient got a rash when they took that medication as a child. In the background in HST eChart, there is continuous monitoring for drug allergy interaction. As soon as the allergies are entered, the system will travel through and look at all of the potential medications that could be ordered for this patient. And it will also look at any home medications that they've already received. If a new allergy is added, the system will run the check again. If a new home medication is added, the system will run the check again. And if a new medication order is added, the system will again run the check. Home medications. HST has a unique relationship with a third party called DoseBot. DoseBot allows our users to ask, with the patient's permissions, to import 12 months of their prescription history, which will populate into the grid below automatically. However, if the patient says no, you will have to manually enter the medications. I'm going to give you a quick sample of manually entering a medication. Lipitor. The patient takes one tablet. Maybe they don't know the dose, but the system will still do the drug allergy check on the generic form of that Lipitor. You can also enter the last dose if the patient is taking a medication that you need them to stop taking prior to the procedure. Patient history is a block. Each of these is considered a block. It's a block that's designed by the center. You can gather whatever medical or surgical history you feel is important, or your anesthesia team feels is important to gather prior to. This is just an example. Your questions may be very different, but you should know that if you say yes, you can have a child question below that, where you could put in the date that it was entered. And the same is true for metal implants, right? Anywhere that you have a question that they answer yes, you might have a sub-question, or sometimes no, and you might have a sub-question. We give you the tools, and we teach you how to create your own previous surgeries. Your own questionnaire. You can do a COVID-19 questionnaire that you can build with all of your own. This one is blank, but that is so that I can show you that if you have a block that does not pertain to your particular case, you are able to remove that block on the fly. you're also able to add blocks on the fly. So for example, if you have a female questionnaire, but you don't want to put it in all your charts, you are able to add that on the fly. This is where you would put in what time you want your patient to arrive at your facility. When you tap staff, it will automatically fill in with the name of the logged in user. Pre-op instructions, again, is a questionnaire block. You get to design what shows up here and what instructions you require. They can be different for different kinds of charts. So if you're putting in a pain stimulator, you might have different pre-op instructions that you want to share with the patient. As you can see, I got 100%. Now, as I go through this chart and all of these workflows, please keep in mind that at your surgery center, you're not filling out all of these workflows. Your registration person is just filling out the registration workflow. So although it might seem a very busy chart with many workflows, each user only has to fill out their workflow to get their 100%. So I'm just going to tap through here and put in the time and the user. I can adjust the time. The patient information we collected on the pre-op phone call, all of that information that we put in there, including the address, is here. Again, you only have to fill in information once. Here's a COVID-19 that you can fill out. This is, again, just a sample. The consents will be your words and your consent. The patient will sign directly on the tablet. We are touch screen and tablet first. That means we utilize all of the functionality of tablets, including the ability for you to take a picture of the patient. Now you might ask, why is it important to take a picture of the patient? And I'm going to just go ahead and select one of my saved pictures. HST eChart allows multiple users in the chart at the same time, and it allows multiple charts open at the same time. So as a pre-op nurse, you might have many charts that you're toggling between as you get these patients ready for surgery. This picture is a safety measure so that when you open those charts, you'll know at all times what patient you're charting on. You'll also notice we now have an allergy banner alert up here. It's important to know these alerts, some of them are set by the system, and they will show up here automatically as you fill out the chart. I'm going to put in registration end, and you can see I did not have to interact with this block itself. The system already put in the information from the room in and from the registration end. And you can see, again, I got 100%. I'm going to proceed to the pre-op nurse. So just to explain the importance of block technology is that these blocks can be arranged in an order that suits your workflow. So as you move through, you will be able to complete each area of care, each required field, and scroll to the next one. Here's that allergy block with that new penicillin allergy we added. I'm just going to review it. So when I went out to greet my patient, the first thing I did was ask them if they had anything to eat or drink, because if they did, maybe I don't bring them back to pre-op. I ask about their allergies as we're walking back. I ask about the height, weight, or BMI, or perhaps I pop them on the scale if it's important to have an accurate measurement. The system will automatically compute the BMI, and it will put that BMI in the anesthesia row in the header. It will also enter the patient's weight in kilograms. That is so if you have to give any urgent medication that requires you to know the weight in kilograms, you never have to look around for it. It's always going to be up in your header. If you enter the information in metric, it will show it in imperial for you, or vice versa. You can document that you've locked up the patient valuables. Maybe the patient is smart and they didn't come with any valuables. You are able to mark NA and you'll still get your green check. Now it's time to say room in, and I'm going to put this patient in pre-op. I'm the receiving nurse, and they were ambulatory when they arrived. Physician orders. Physician orders are created as a set of standard orders. The physician will sign those orders in their workflow. Let's deviate for just a second and go to the physician workflow. Your physician can sign these orders as soon as the case is posted on the schedule, but they usually don't. They can see that H&P that we saw earlier, the H&P, just like the previous visit, is a hyperlink that will open in a brand new window and allow you to review the history and physical for this patient. Physician orders. The physician has these orders already pre-established for him. Some are standing orders, some are standing PRN orders, but you can see the med check has been done. The med check for a lot of these medications, when you get a caution, is to let you know that there are sensitivities that may happen when you give, in this case, too many lidocaines, xylocaine, and this lidocaine solution. It's wanting you to know that you're giving two drugs that contain the same. First, at fentanyl, they're going to let you know not to let the patient drive that John Deere tractor home. The physician can select the orders that they want to sign. They could delete the orders that they don't want to sign, or they can just select all the orders and apply their signature. I am logged in as me, so the physician is going to log in over my shoulder. And you have to know their password. That would help. And now you can see that these orders have a lock on them. That means that they were signed by the provider. History and physical attestation. Because there is a document attached, that is the H&P that was performed within the last 30 days, there is no need for the doctor to do one on the chart. However, if they needed to do one, we have a block that they can add on the fly to do a limited H&P directly in their workflow. But this is going to say that we have an H&P, that the doctor has examined the patient and there are no changes, and that the patient is secure to do this case under this anesthesia at this surgery center. So again, you just sign over the shoulder and the physician's signature will be attached. Med reconciliation, there's that Lipitor that we entered. Yep, all the home meds will populate your medication reconciliation, and the doctor simply has to check to resume as prescribed, or any other time that he would like it to be prescribed in days and hours. Here's a med check that has green, no issues, you can see that. If they do not give prescriptions upon discharge, you would check this box. And again, the physician can just sign. If he was logged in, he wouldn't need to sign over my shoulder. Perfect. Now, next is the operative report. The system will not allow the physician to complete the operative report until the procedure has finished. So let's go back to that pre-op workflow and see what that looks like. Fabulous. You can see where we got to, physician orders, and now you can see that these are locked. And as the nurse, I would just tap and sign. Here's my procedure consent. You can have the patient, again, sign directly on the tablet. As the logged in user, I can witness this. If at your surgery center, you also require the physician to witness the consent, you can absolutely have a line here for the physician as well. Vital signs are pulled in manually, or through an interface if you have one. We're going to use the room in time, and I'm just going to enter some pretty typical vital signs. If you came back in 15 minutes and there was another vital sign on the patient monitor that you wanted to bring in, but it was almost exactly like this one, you can do something called clone. You can clone this entry, use the now time, and maybe they're just a little more relaxed, and you're going to save it. That was the only vital that changed. It will create an all new row for you. You can also use the tablet to capture that 6-second EKG if your center requires it prior to going back to the OR. If it doesn't, you can simply check NA. The pain assessment is the pain prior to. This block is cumulative. So that means when it shows up in post-op or PACU, the nurses will see what you put down as the patient's pain level. So the site of their pain is achy and throbby, and it's in their spine, and they're here for the medication, so no additional medication is required. This next block, fall risk assessment, is called a clinical decision support block, and you are able to complete this. It will calculate a score, and it will give you the risk level for this patient. And because it's a high risk, it put the banner alert. But you'll notice the consent banner alert is now gone. You get to pick the therapeutic interventions. Here's the home medication block, again, just for you to review. The medical surgical history that we got on that pre-op phone call. This is how we would document the insertion of the IV, how many attempts it took. Is it a saline lock? In which case it will select none for you. Of course, the other options of fluids are available. Who inserted it, and the dressing was secured. You can also document on this image capture where the IV is. This is especially helpful if you have tried several attempts at an IV and were unsuccessful. You can mark where the unsuccessful ones were so that your PACU or post-op nurse is aware that they should check the sites. Medication administration, anywhere in eChart where you can administer or order the medications, the allergies will always be listed. In this case, penicillin. We have no pre-op medications for this patient. Once the orders for any medication are signed, the system will disperse them into each workflow so that I don't have to, as the pre-op nurse, plow through all of the orders to try to find mine. Mine will automatically populate my orders, and my meds, once signed, will automatically populate. You can have verbal orders. You can also have standing orders, which will populate upon admission. Patient status. We have a patient locator, and this is where you would enter the status. We have other statuses as well. Perhaps you get to create these, by the way. They could be delayed. They could be ready for the OR. They could be ready for anesthesia, ready for a block. You get to create those yourself. But the ready status is created by HST, and you simply have to tap that. It lets the OR nurses know that this patient is ready. We have built supplies used directly into the workflow so that each user gets to mark off the supplies that they used. The information can come from the preference card, which will populate it automatically for you, or it can come from actions that you take in the workflow. We'll see what that looks like as we progress through. In this case, I'm just going to confirm that. Again, I'm not going to do anything with the staff block. It will fill in automatically. We also have a helpful addition that will fill in the room out automatically for you based on the next workflow's room in. Now, why is that important? That's important because you're taking care of multiple patients at the same time. You may not exactly see which nurse comes to get your patient and takes them into the procedure room. You also may not know exactly what time they walked out. So you're able to set a configuration flag to backfill this block and this block with the required information. Now, I told you you can toggle between workflows, which is super helpful if you're a pre-op nurse taking care of 3 patients. How you do that is the pin button. So I'm going to push the pin. Now you notice I have 2 other patients that I'm getting ready at the same time. If I tap on this, it will take me directly to this patient's chart, their pre-op workflow, and the block that I left off on. So it brings you all the way to where you need for that. It will also do the same thing for the other patient that I have pinned, and it will take me to that patient's workflow. So you always can toggle between, which saves you from having to go back to the menu to complete it. So I'm going to go back to our patient who we're taking care of, Dennis. And you see it brought me right back to supplies used where I was at the end of this workflow. I'm going to go to intra-op. Now, as we talked about, intra-op, I've designed this chart. We teach you how to design the charts. You get to edit them. You get to change them. You get to do what you need to do. I split it up into 2. We have your circulator and we have your nurse monitor. If you want these all to be one workflow and have the nurse monitor do all the paperwork while the circulator circulates, that is absolutely fine. But we're going to pop in to the intra-op workflow. Now, intra-op workflow, as you can see, starts with room in. So we're going to go ahead and room in this patient. You'll notice in the background that I have a late start study built in. That is a flag you could turn on or turn off, depending on if you want to do that as a QAPI. And we're going to bring this patient in by wheelchair. HST chart has the functionality that allows you to rapidly populate non-patient specific information with the push of a button. We call it quick chart. In this case, as soon as you have a room in time, I can apply the quick chart for pain. You see it's going to work for a few minutes, and it's going to rapidly complete all of those pieces of information that stay the same. It doesn't happen without your approval. So it's asking you to just say, yep, that's my wound class. Yep, that's my positioning. Yep, I don't have any positioning aids. If you do, it would populate that as well. Thermal regulation, that each patient is different. So maybe in this case, you have a warm blanket on the patient. Let's just say it's on their lower body. Any equipment that you're using on this patient, for example, if you have a C-arm that's coming in, you're able to add the equipment here that will pre-populate with the serial number because of quick chart. Your surgical safety checklist will not pre-populate. That is information that you get to create it, so it's your questions, but you have to complete it. The timeout is a hard-coded HST block, and it populates the timeout information to many reports on the practice management side, as well as to the clinical log. The prep is completed. Procedure start. If you fill in procedure start and anesthesia is on your case, the procedure start will populate the anesthesia workflow. If it's in the anesthesia workflow, it will pre-populate here. So they share information again. You only have to enter information once. Now, in this case, there are several medications. You can administer them by selecting them all and administering those. Oh, these are orders. I beg your pardon. You can select them and you can sign all your orders at once. And here's the medication administration. So you can select them all and administer selected. You can select just a couple and administer them together if you'd like. These two, Versed and fentanyl, we have here as a set, and you can administer them as a set. So if I say administer the set, it's going to go ahead and put in the now time for the Versed and fentanyl. And maybe I want to reload that set because I'm going to give a second dose perhaps. You can reload it by reloading the set and then administering the set. So I'm just going to select them all and administer the selected. Here's your C-arm. So you see it populated the serial number of the C-arm. This is the full bed C-arm that's in radiology. And X-ray precautions were observed. And you can enter the exposure time. This will populate a radiology report. And I'm not sure, you can record, it will take alphanumeric, so you can put whatever source of exposure, however you record it. But this will complete the block, and this will populate a radiology exposure report. The diagnosis information, that came from practice management, so I'm going to load it. If I need to edit that diagnosis, either before or after the procedure, I can absolutely do so. I can edit it directly in line. I can edit it with a plus and add a secondary diagnosis, should there be a need for one. The procedure information is the same. I can load that procedure information, I can edit it, and I can add to it. Then we're going to go ahead and push procedure stop. Our dressing is a Band-Aid. This populated from the quick chart. And here are my supplies used. If I change this Band-Aid on the fly to 4, when you look at supplies used, it's going to change that Band-Aid number to 4 for you. Again, no duplicate entry. The supplies used are in the workflow that use them, and the nurse is able to simply confirm them. Let's take a peek at what that secondary intra-op workflow would look like. And again, you can combine these if you want to. But they will have a couple of blocks that are not always in the chart, particularly if you have an anesthesia provider. So this conscious sedation just allows you to familiarize yourself with some information about the patient, any monitors that you may want to apply. And then we have the graph. The graph allows you to pull in vital signs and medications in the typical fashion that anesthesia providers are used to, but it comes in very handy for nurses as well. You can have an interface to the monitors if you need. You can manage the medications that show up here by simply tapping and selecting a different medication that you'd like to use. You can manage the gases also just with the touch of a button. You'll see that all of the medications will total themselves on the far right. You also have the temperature, the level of consciousness, the SpO2, any of the fluids that are populated here on this graph will also populate the intake and output. And you have respirator settings, which hopefully you won't use for a pain injection. But how can you use this for vital signs? It's very simple. You would drag and drop your vital signs directly into the chart, and green indicates now, by the way. So if you wanted to add a new set here, it will continue to graph these as you move through the continuum of care. You can drop an easy note right in here. Just tap on it and add the note of your choice. I'm just going to write the word note so you can see how it will display on the graph. If you hover over it, it will tell you exactly what it says. Below the graph, you're going to have the grids. The grids will tell you the medications, the infusions, the vital signs, the intake output, ventilator settings, and that note that we just took. Any providers giving care can sign. And if the pain provider is supervising your anesthesia care, they can sign up here as well. Okay, so believe it or not, we're up to post-op. So your post-op workflow has blocks that are going to be utilized for post-op care. Obviously, we have room in, again, just as we did before. Oops, we're in post-op.